Check the mic.
Checking the mic.
1, 2, 3. All right, we are live in 5, 4, 3, 2, 1. Welcome to another special edition of
Beyond the Doughnut.
This is a special report, and we are going to be focusing on today's events occurring here at the end of March. Social distancing is our topic, as we saw a lot of different bars and places of interest for people to meet get shut down over the last course of the 24 hours. Garrett, why is social distancing, why is this happening? Why are bars being shut down? Why are people not being able to go to access their yoga classes? We're seeing restaurants start to close and only do takeout orders. Tell us a little bit about this.
So to understand why social distancing is important, we have to know a few things about the virus itself. Coronaviruses are viruses that have been around for a long time. 4 of the strains are the common cold that we experience, and they exist in the respiratory tract. That's what they latch onto, and that's where people get infected. And so because it's in the respiratory tract, this virus is airborne, which means that it can live in the air for a given amount of time. So every time we breathe, every time we cough, every time we sneeze, we're transmitting that virus out if we're infected, which is how other people then get infected. Now the CDC recommends that you wash your hands and you don't touch your face as much as you can, because the viruses can also still live on surfaces. So if someone coughs in the air or onto something, then your hand touches it, and then you then touch your face. It's an easy way to transmit the virus right into you.
Yeah, so we're seeing that these public eating areas are closing, and basically Donald Trump has called for all people to start trying to work from home if at all possible. We're in a 15-day waiting period. Today would be the 14th day, and we're being told to not meet up with people in groups of 10, or we want groups 10 or less than that.
Small groups.
Yeah, so small. And I think that just goes to say it's a necessity for those people to link up at all. If this is just a social gathering, we're practicing social distancing, and by trying to find a new routine when it comes to our exercise and whatnot, giving each other that space. So what else? How did this basically become a pandemic? And why did it go from maybe being something that people weren't so worried about to something that now has become a much bigger phase in this development? As we saw Donald Trump even saying that, hey, this is a big deal, it's no one's fault, but we need to start taking some big action.
Well, the reason it's a pandemic, we briefly mentioned it in the first episode, but it's good to know the differences of these things, is that this virus easily spreads between people. So it can spread easily over a short period of time, infecting a lot of people, and a lot of people that had nothing to do with traveling or anything like that, but it comes into our communities, and it starts going across the globe. Now here in the United States, what we're trying to still prevent is an epidemic. So that's a smaller localized thing. So in Washington State right now, like I believe it's in Seattle, they're experiencing an epidemic. They had a large outbreak in a small little area, relatively small area. And that's dangerous again because we want to slow the acceleration of the virus. And now when the CDC comes to these sort of things, with the guidelines they put out, there's 2 important things to know. When a new virus like this emerges, the first thing they're trying to do with a lot of their resources is containment. And so they use a lot of resources to track down where the virus started, who was in contact with people who were infected, quarantining them, and stopping the spread over a larger area. Now, unfortunately, we are past the containment stage, and now we are in the mitigation stage. So what that means during mitigation is that the virus is going to spread. We can't control the containment anymore, but we can control the acceleration that it's going to spread. So as it turns out, most estimates are saying about 50% of us are going to contract this virus at some point. It's about 1 in every 2 people. So there's 2 of us right here. 1 of us will most likely contract the virus. Now, the important thing again is slowing the acceleration of that spread. So if 50% of us are going to get infected, we want that to happen over a long period of time, so that way our healthcare system isn't overloaded with patients coming in. Because again, the social distancing, staying in groups of 10 or less, especially when it's only essential, the non-essential things we have to give up, is to protect those who are most vulnerable to this virus and who are most vulnerable and need life-saving medication. Not medication. It's life-saving care like ventilators for those with different lung problems and stuff. From the system becoming overloaded and those life-saving tools that we have not being available to a lot of people in a small amount of time.
Yes. So this mitigation has kind of fallen into the traveling and people understanding that, unless it's completely necessary to travel, you shouldn't be going to fly out for any type of vacation. Mm-hmm. It's time to return home to try to contain this virus. And I think that's what's so interesting is that we're just becoming aware here in San Diego, where places like San Fran, now they have what is kind of like a curfew going on, and people are being really asked to stay alone, stay by themselves. That's kind of where I want to get into the segment now. We're going to talk to our friend Brody Thomas, who is just returning from a work trip. Now he's still going to work. His job hasn't called him off yet because there's still work to be done. What can he kind of envision? Do you think that places like this are going to start closing down and sending their employees to work primarily just at home? What's the process there?
The process is interesting. And the most important thing to remember, I think, like right now, is that the pressure should not be put on individuals who are living paycheck to paycheck, who are being told they have to go to work, to not go to work. Because in most states, like in California, in order to get unemployment, in order to receive those benefits, you have to lose your job to no fault of your own. So if your employer isn't sending you home, most likely you're not going to be able to receive any money. The pressure needs to be put on a lot of these businesses who are still having people come and work in non-essential fields, pretty much anything except the health industry and maybe like the food moving industry, food trucking. Those people need to be sending their employees home to, again, prevent the spread of this at a rapid rate and to hurt those who are most vulnerable to this virus.
Yeah, so maybe we can go to Brody just to get a little outside perspective. Brody Thomas is going to be coming at us live, just fresh off the plane, coming back from Colorado on a little work trip.
Yo, so I spent the weekend in Denver, and it was kind of weird. I expected the airports to be a lot different. It just kind of, if I didn't know that this was happening, I'm not sure I would have noticed anything different, which was weird. Other than some places, restaurants and bars being closed, I did go out, which in hindsight now, I don't know, can't change the past, but I think going out, it would seem like it was just full of a lot of everyone being kind of confused, kind of a mixture of like confusion and wanting to know what to do, what not to do, wanting to kind of get in their fun time before whatever gnarly stuff is to come. But definitely by the end of that night I went out, I was kind of like, okay, yeah, I get it. And so went on a hike, pretty normal amount of people hiking, but I mean that's pretty, you're not really coming in close contact with anyone, so that was cool. I think that would be some decent stuff to do, maybe. I don't know if that's frowned upon as well, but outdoor stuff seems alright. Camping still seems to me like some sort of version of isolation, and so yeah, I just think now, I don't know, I'm not in panic, but the more I hear it's gonna get worse, the more I believe it, and so trying to do what I can, I guess, now. Just laying low, and I still have to go to work also, so that's like, I don't know, it's weird to see different sectors of the world react at different times and in different ways, and I'm interested in to see what this looks like in a week, in 2 weeks, in 2 months. So I don't know much. That's what I know.
A perfect example. Thank you so much for that, Brody.
Thanks, Brody.
Yeah. here's a perfect example of what we're talking about. We are given a certain amount of information. It's coming from different cities at different rates. One health expert, one leader of the nation is saying different things, and we're trying to formulate an idea of what's going on. And now pretty much everyone has gotten the idea, hey, containment is necessary. Social distancing is necessary, just like we heard Brody say. You know, he then went hiking for his kind of extra experience that next day. It didn't include him going to the bars, even though he was probably in a state where, you know, it's a new environment. You want to go out, meet people, but that isn't going to be happening right now. Why is, just for one more time, why are we being told to stay away from each other? Because a lot of us young people are healthy, and we've heard that a lot of young people are going to, you know, have the immune systems to kick this bug right out of their system. How is this thing spread? What is the deal?
So with it being airborne, that means
my face. I have to stop touching my face.
It's a hard thing to learn, but it's a good thing to practice. So with the social distancing, the reason why they're advising 6 feet is because that's about how far the virus can travel from a cough, from a sneeze, and from breathing. Again, this thing is airborne, so although you're not directly touching someone, and even if they aren't sick with symptoms yet, they still could be infected with the virus and transmit it to other people. So with the onset of symptoms being 2 to 14 days after exposure, during that 2 to 14 days, you could still be spreading the virus unknowingly. And that's why the social distancing of keeping that 6 feet, staying in small groups, only not traveling, only moving really around in your local area for essential things like when you need something at the grocery store, prescription medications, or going to the doctor, is so important to slowing the spread of this virus, because you're not also accidentally transmitting this to others. Because again, you may have no symptoms, and you may be going out, and maybe even arrogantly going out and saying this whole thing isn't real. But the kid with diabetes behind you in line that gets sick, he's now fighting for his life because you didn't make the responsible choice of staying in and staying away from these types of people.
Yes, we're living in the solution of protecting those that could be vulnerable to this virus. You brought up, and I only want to go here just for a second, but when grocery stores don't have food on their shelves, what does this mean? Because for a lot of people, we have a heightened scale of panic, or we're running out of food. Can you briefly touch upon what me and you have been discussing in these last few days? Because this has been great information.
Yeah, so like the number one thing is we don't have a food or agricultural shortage right now. It's not like there's a dust bowl going across half the country that's just wiping out our crops. And it's not like we have any problems with imports right now either. The real reason why we have a very short-term food shortage at some of your stores is because people are buying way too much right now in a panic. But the thing is that there's food that was already scheduled to be delivered on the way, truckloads of it. It was just part of the normal grocery store schedule that's still coming in. The food is still being manufactured at a lot of these warehouses. And a lot of the food that needs to be manufactured that we're going to be getting wasn't manufactured yesterday or the day before. It's been manufactured in the past few weeks. And so right now, don't panic if there's not the exact food you want at the grocery store. Just be patient. Make sure you have enough for 1 to 2 weeks, which is a normal grocery store run. And again, just be patient. The food is going to come in, and we are not anywhere near a food shortage right now.
I mean, look at like the similes. It's like, everybody panics, runs in to grab all the food. Obviously, there's not going to be food there. Now, if this disease, if we don't try to take precautions and we don't actually understand what's going on, if we don't take the time to watch videos like this that tell and explain what's going on, the same thing's going to happen to our hospital beds, where there's not going to be the hospital bed for those people that need it. And that's not to say that we don't have a healthcare system here in America, because we do have a healthcare system. We're just saying that with this disease, with this pandemic, it'll be overloaded, and we need to take precautions, understanding how we're going to navigate the healthcare system that we have here in America. If this had happened in a different country that didn't have a healthcare system, just imagine what, could result in that. Got kind of tangented away, but that brings me to a really good interview we have here with Mia Lassiter. Mia Lassiter is basically going to touch on some subjects of just the amount of information that's being put out there. Now, remember that this show that me and Garrett are creating here, we are fact-checking all of our information with independent and reliable news sources, but then we're also going to the CDC and making sure that those numbers, that factual information that we're giving you is true. Mia, just give us your thoughts real quick about what you're experiencing when it comes to just the understanding of not just what's going on when it comes to the numbers, but emotionally. I kind of want to know, because I know that me and you talk on some deep levels, so let's get deep.
Hello, Matthew Barry. Here are my thoughts on the coronavirus. I think that there is a very large amount of fear around the virus itself. I think there's a lot of unknowing because of the sort of contrast in what is being reported on the virus. There's so many different news outlets that are reporting just drastically different accounts of what is actually going on. And I don't want to pretend that I know what's actually going on, because again, I'm just, a regular citizen that's being fed a slew of news. And I think that the unknowing is what is really scary about this. That being said, what I do know is the precautions that I can take are to socially distance myself from the people that I would normally otherwise be around, whether that's like going to open mics or like going to bars. Like you have to, or at least myself right now, as a precautionary measure, I'm trying to stay home, and that's just because I have people in my life over the age of 40. I have people in my life with pre-existing conditions that I do want to see in the next couple weeks, and because I want to have them in my life the next few weeks, I am deciding to put myself in situations that are not going to threaten them in the future. So that's something that I'm doing personally. I'm not going to the grocery store and stocking up mountains of toilet paper. I don't think that's necessary. I'm not letting the fear that's being drummed up around this matter ruin my life. I'm going on every single day and just taking more precautionary measures than I normally would. And I'm just trying to see that everybody is looking out for each other. I think during times like these, your sense of community really is important, and you really have to look out for one another. But this is fucking crazy. Like, this is crazy. I've never had to deal with anything like this in my life. But I don't know. We'll see how it goes. I'm gonna go to the store at 6 o'clock in the morning and try to fucking get some shit, because I guess that's the only time that you really can get anything right now. So we'll see how it goes. If all else fails, I'll take my money and run. So that's what I got.
Yes. Awesome, Mia.
Thanks, Mia.
Yeah, I really appreciate. We really appreciate all the friends that are willing to be a part of this. We want to get everyone's opinion. So as we start to get videos, we are going to try to include those in our show the best way. Please get in contact with me if you would like to be a part of this show, and we'll start showing more as we are trying to up the ante. We're on the road to at least releasing one episode a day. We're thinking about releasing episodes in the morning and in the afternoon. That's just something that we're doing to get creative. I'm making music in my spare time. Garrett, what are you doing in your spare time?
I'm doing this. I'm making music. I've been checking in on my family over the phone, as spread out everywhere, just seeing how everybody's doing. Calming some fears when I need to, and sometimes they have some questions that I can help them out with, which, is one of the important things I've been doing for a little while, but especially now, is keeping myself educated on what's going on, what this virus is, and how it's going to impact us. Because most of the things that are going to happen over the next few months are predictable. Some things aren't, but a lot of things are predictable. And knowing that information ahead of time has made this whole process a lot easier for me, because I was ready.
Guys,
Okay,
I wrote a
let's
rap
sign
about
off one more time.
coronavirus.
And here's Kim Yi. She's going to take us away. Thank you so much, Kim Yi, for this hilarious content. It's going to be the coronavirus rap.
The coronavirus rap. Let's hear it.
Coronavirus season, don't let it get you down. Avoid the crowds, don't be a clown. It's coronavirus season, if you need me, I'll be found. Chilling underground, inside the house. Hide your paper in the cabinet where nobody be grabbing it. Be thankful for your health, it's the only form of wealth. Vaginas in the streets, they be freaking in the sheets. Patients flaking on the G-Wa, and instead they getting it in at home, in our space. We can be all alone. Spray Lysol, spray Febreze, try to hold in your sneeze. Corona. It's coronavirus season, don't let it get you down. Avoid the crowds, don't be a clown. It's coronavirus season, if you need me, I'll be found. Chilling underground, inside the house. Hide your paper in the cabinet where nobody be grabbing it. Be thankful for your health, it's the only form of wealth. Vaginas in the streets, they be freaking in the sheets. Patients flaking on the G-Wa, and instead they getting it in at home, in our space. We can be all alone. Spray Lysol, spray Febreze, try to hold in your sneeze. Corona. Yeah, I hope you guys are all staying safe and well and informed according to credible sources. Please consider and follow social solidarity and making social distance as much as you can, because why should we not prevent as much suffering as we can in our hospitals and communities? So yeah, I believe in doing our best, and I encourage you all to think about doing your best too, whatever that looks like. And yeah, stay chill, don't freak out, don't hide your paper.